Brendan Dassey trial transcript, day 4, page 66, continued testimony of Dr. Eisenberg. We have that now on the screen. Does this photograph assist you in explaining why you concluded these were the remains of a female? This image is one of the areas I looked at in the body that allowed me to make that conclusion. All right, tell us about that. What? Now there is a laser pointer. It should be right next to the, yes, witness box. Thank you. And if you would probably use the larger screen to point, it might work better. Okay. Are those shovels in the way? Rakes? No, they're not. What we are looking at here we go. What we are looking at in this image are fragments from a face, and we are looking at these fragments as if we are looking at someone face to face. And so let me point out some of the landmarks to you to help you orient what it is you're looking at. This area here represents the top of the left eye socket. This fragmentary bone and this eye, the top of the eye socket, is actually part of the bone that continues up to become the forehead. So we have the top of the left eye socket, the left half of the nose. The nasal bones are 2 in number, and what this fragment is the left half of the nasal bones. These are fragments from the right, what would be the area above the right eye socket. This is a complete and one of the few complete bones that I actually had an opportunity to examine, a complete right cheekbone. And while the placement may be a little off in this photo, what you are looking at here is the lower portion of the right eye socket. This is a fragmentary portion of the left cheekbone and a portion of a bone that runs from the left cheekbone over and above the opening for the left ear. All right, if we could go to the next exhibit, 187. Yes, sir. And what are we looking at here? What we are looking at here is a close-up of a portion of what we saw in the previous graphic. Excuse me. Again, the top of the left eye socket, the portion of that then continues up to be the forehead, or what we call the frontal bone, and the left half of the nose this would be the area that we would refer to as the bridge of the nose. This is the left half of the 2 nasal bones. All right, now with respect to the last 2 exhibits, 186 and 187, what is it about them that specifically assists you in identifying these remains as a female? Fairly diagnostic or telling to any forensic anthropologist or any biological anthropologist is that there are certain shapes that are characteristically female in the skeleton, and other shapes, what we call morphology, that are characteristically male. And one of those key locations that anthropologists look at is actually the top of the eye socket. In females, that rim or ridge is fairly sharp and does not protrude. In male skulls, that area, that edge, is fairly blunt, and you often see heavy bone development over the eye sockets. And we don't see that here. I don't see that here. And what I see in terms of morphology and shape and general bone architecture to the facial bones, but especially above the left eye socket, leads me to conclude that these facial bones, and in particular this bone here, comes from a female. All right, now, doctor, during the course of preparing and in reviewing the matters of this case, did you have occasion to work with a Tim Austin from the Wisconsin State Patrol? Yes, sir, I did. And did he assist you with some of the exhibits that we're about to see? Yes, he did. All right, if you would take your attention to the next photograph. All right, and this is exhibit 188? Yes, sir. And what are we looking at here with exhibit 188? What we are looking at here is a graphic depiction of not a real skull, but a computer-generated skull, and the arrows and the descriptions on this graphic point to the areas of the skull and the facial bones that have been recovered and identified by me and described to you in the previous slide. And that I see there's a notation, evidence tag 8318. Is that at all reference to the box that we previously examined? Yes, sir. The area, we don't see all of it here, but the identifier for this particular slide that says evidence tag 831, and we'll wait for the 8 to show up, 8318, was the evidence tag identifier for that white open box we saw earlier on. The material that was initially collected and the material that I initially examined and sorted through. All right. Next exhibit, please, should be exhibit 189. Yes, sir. All right, and if you would, what is depicted here? What is depicted here through the work of Trooper Tim Austin are 2 computer-generated skeletons. The one on the left represents that of a female, and the one on the right that of a male. All right, and in terms of the eye sockets, if you'd take a moment to highlight the distinctions that you've just been talking about. In the fragmentary skull and facial bones that were recovered, the area that I was pointing out a little bit earlier was just above the left eye socket and above the bridge of the nose. In this female skeleton on the left, I hope you can appreciate the roundedness and the sharpness of the rim, or the top edge of that left eye socket. Would it help if we zoomed in on that? It may for the jury, sir. This area in particular is a hallmark of what anthropologists recognize or identify as coming from a female skeleton, because it's a relative gracileness, or I guess sharpness and smoothness of that edge. In contrast to what we would see in a typical male skeleton, here's the bridge of the nose, the top of the left eye socket, and I hope you can appreciate or see the area here where above the left eye socket there's a considerable buildup of bone, and as well the edge or the shape of the top of the eye socket is much more rounded and substantial. Doctor, although you determined the relative age and sex of the person, were you able to determine ancestry or stature of the person after your examination of the remains? No, sir, I was not. And that was because of the extreme fragmentation and burning that did not allow me to reconstruct some of the long bones, in particular the thigh bone that I would typically measure to develop a stature estimate. Likewise, many of the landmarks that I would use to determine ancestry or racial affiliation were not present because of that fragmentation. All right, as a forensic anthropologist, are you familiar with the concepts of cause and manner of death? Yes, sir, I am. First of all, tell us, are you frequently asked to render opinions on, for instance, cause or perhaps manner of death? More often and most often, I'm asked to render opinions as to what's called manner of death. By what mechanism did someone die? Less often, cause of death, because often that's the purview of a forensic pathologist. But in cases like this, where the remains are so fragmentary and are too fragmentary for a traditional autopsy, it often falls to the forensic anthropologist to make a determination about what's called cause of death and manner of death. All right, then in your field of forensic anthropology, what is the difference between cause and manner of death, if you would explain for us? As is generally understood in forensic anthropology, cause of death is fairly explicit. In other words, what did the person die from? Manner of death, however, speaks to the mechanism. What caused the death? How did the person die? All right, can you give us an example, for instance, of a distinction that you might commonly run across in your forensic work? Oh, I guess cause of death, if I pretended to be a forensic pathologist for a minute, might be heart attack or tuberculosis. A manner of death for a heart attack might be accidental. Manner of death in general, there are 4 different categories that are understood when we talk about manner of death. And one of those categories can be a natural death, which might result from a heart attack. A second category of manner of death might be considered accidental. Did someone fall off a ladder, hit their head, or sustain a spinal injury and die accidentally? A third manner of death is suicide. And fourth, most commonly recognized, is homicide. Is there sometimes a fifth, such as unexplained? Unexplained, or sometimes even a sixth being undetermined. Okay, based on your training and experience, based upon your training and experience and the examination that you conducted in this case, do you have an opinion as to the manner of death of the individual whose remains you examined? Yes, sir, I do. What is that opinion? It is my opinion that the remains of the individual I examined died as a result of a homicide, and in particular, homicidal, what I am calling homicidal violence. All right, now during the course of this investigation, did you have an opportunity to meet and consult with a physician by the name of Jeffrey Jensen? Yes, sir, I did. And who is Jeffrey Jensen? Dr. Jeffrey Jensen is a very well-known and well-respected forensic anthropologist who is the medical examiner for Milwaukee County, Wisconsin. All right, and just generally then, the distinction between a forensic pathologist and a forensic anthropologist, which you are, just briefly, what's the difference? Well, if you ask a forensic pathologist what the difference is, their first answer will be that they have been to medical school. They are real doctors. And forensic anthropologists are fake doctors because they only have a PhD. But in general, forensic pathologists are doctors who specialize in pathology and who have further training and certification in a field called forensic pathology, or pathology that is applied in legal context. They typically perform autopsies on all types of remains, most of which I would say are recognizable. The people can be visually recognizable. Sometimes those individuals have died as a result of a burning episode or a drowning or any other type of activity. All right, and did you and Dr. Jensen look at several of the cranial fragments during the course of this investigation? Yes, sir, on one occasion. Very well. I'd like you to return again to your opinion regarding homicidal violence and ask you, why do you believe, based on your examination, that that is the correct or accurate manner of death? After having examined all the fragments, and you have just seen one box of 50 different containers that I had the opportunity to sort through to distinguish human from non-human bone, to look for diagnostic human elements, to look for human bone that may have showed signs of trauma, to try and refit fragments that may have come from any one of 50 different containers. There were two skull fragments in particular that to me showed clear and unquestionable evidence for what I consider ante-mortem or before death trauma. All right. Was there anything about the fact that the fragments were burned or calcined that attributed to your opinion on homicidal violence? Well, I think anytime remains are burned beyond recognition and that burning is not of an accidental nature, I think that the fact that these remains came primarily from a burn pit, that the fact that someone attempted to obscure the identity of another individual through burning certainly could be considered part of that umbrella heading, homicidal violence. All right, doctor, would you look at the next photograph? This is marked, I believe, Exhibit 190. Yes, sir. What are we looking at in Exhibit 190? We are looking at something that's probably unrecognizable to everyone in this courtroom except myself. There are two skull fragments here. We are looking at the internal side of two skull bones actually three skull bones. I was able to refit these two bones together along this fracture break, as well as a third fragment that fits along this edge. These are three fragments from the left side of a human skull, and one of those fragments shows evidence that I believe would speak to my determination of homicidal violence. All right, if you would take the pointer and describe for us what it is you're looking at. Yes, sir. The reason I know that this is the inside of a human skull are these vessel impressions, these blood vessel impressions that kind of look like spider webs or an aerial view of a road network somewhere in this country. The vessels that run along the inside of the skull actually sit in these channels, and the positioning of these channels and the direction of these channels actually allows me to make a determination as to whether this bone comes from the left side of the skull or the right side of the skull. These three bones are all part of a bone called the parietal bone, P-A-R-I-E-T-A-L. And we have a parietal bone on the left side of our skull and a corresponding or mirror parietal bone on the right side of our skull. All right, and what is it about the indentation at the top of the picture here which is of significance to you in your opinion on homicidal violence? When I looked at this fragment, there was an area of this fragment that caught my attention almost immediately, and it's this area here that I believed was quite significant with respect to a determination of homicidal violence. To me, based on my experience, this would be considered what's called internal beveling. Now remember, we're looking inside the skull at this moment, and where the hard, compact bone of the inside of the skull stops, what you're looking at is kind of a honeycomb-looking bone. That is a bone that's sandwiched between the outside of the skull and the inside of the skull. And whenever there is an unnatural defect to the skull that looks like this, where you have internal beveling, or what some people call cratering of the inside of the skull, it is identified as an entrance wound from a gunshot. All right, next exhibit, this is Exhibit 191. Yes, sir. All right, and what are we looking at in Exhibit 191? What we are looking at here is the flip side of the three bones we had just examined depicting the inside of the skull. What you are looking at now is the outer portion of the skull, and I would call your attention to this area right here. That is the flip side, or the other side of the area that I've identified as the entrance wound from a gunshot. All right, now I noticed, just so that we can have it explained, there seem to be some colored dots and one arrow on there. If you could tell us if you know what those are. I would be happy to. Initially, because there were so many fragments to examine, and those fragments each were identified with the location from where they came from, I thought it might be necessary to begin to mark the bone to reference their location of where they were initially found. And what I started to do was to mark those individual fragments that had come from different locations or from the same general location, simply with different color nail polish.